Hello, everyone. This is Dr. Paul Schattauer, and I am here with a special guest, continuing our series on green medicine conversations. And I am thrilled to have a special guest today, Dr. Ryan Rehl from ENT Valley in Phoenix, Arizona. And we are going to have a discussion, and I'm going to pick his brain on the the importance of vitamin D and what vitamin D is in our bodies and where do we get it, and we're just going to do kind of a round robin with that. And I hope I met Dr. Rehl last year, and I heard of him last year, I guess. In a lecture that he gave. It was, and I found it. I came across my Google feed, I think, and he had this really articulate lecture on vitamin D. And if anybody wants to watch that after we're done, that's on YouTube, and you just search for Dr. Ryan Rehl, and vitamin D, and it comes right up. First of all, Dr. Rehl, welcome and thank you for being here. I appreciate all the time that you're giving us and helping us understand this.
Well, thank you for having me, Paul. I'm happy to be with you today and share and talk about vitamin D.
Can you talk a little bit about the whole way in which we get vitamin D in our bodies and what it actually does, what the molecule does once we get vitamin D? And I even have heard that it's not really technically a vitamin per se, because we don't really get it in our food, right?
Yeah, technically, it's not a vitamin. It's more of a it's more of a sterol or even a hormone, but and really is a big factor in epigenetics. So it can turn on genes and
Mhm.
transcription. So it's really fascinating. But how do humans get vitamin D? Well, you're right. We don't get it through food primarily. We do get some through food. We get enough through food thanks to the government to just prevent rickets in
Mhm.
children. But really, we make vitamin D through our skin and the interaction of our skin with the sun. So there's a precursor to vitamin D in the skin called 7-dehydrocholesterol. When the sun hits your skin and soaks and penetrates the skin, it converts that 7-dehydrocholesterol to D3, but to vitamin D, excuse me. That vitamin D is not the active form of vitamin D. That vitamin D has to go through two hydroxylations. So it goes to the liver and the kidney to get hydroxylated,
Mhm.
where it becomes 125 dihydroxy vitamin D, and then it's the active form. And that's as much as I learned in medical school. And once it becomes 125 dihydroxy vitamin D after the hydroxylation in the liver and the kidney, it helps you absorb calcium from your diet, and it puts calcium into your bones. And
Mhm.
that's kind of what I learned, and enough to get a medical degree. Well, in fact, it turns out there is pretty much a vitamin D receptor in every cell,
Mhm.
and it's broadly active in our body. So it turns out that it's really beneficial in the immune system, cardiovascular,
Mhm.
respiratory tract, all these different areas. And in fact, one of the papers I read in our literature, it turns out that your sinonasal mucosa can even do that second hydroxylation to activate vitamin D. So vitamin D has been everywhere all along, and we just didn't know it. I mean, as a clinician, I didn't know it. Scientists and those who are much more knowledgeable regarding vitamin D physiology and those in the endocrinology world have known this. But it was really fascinating for me to learn that, look, vitamin D is ubiquitous. It's been there all along, and its actions are ubiquitous as well.
But how was your interest tweaked as far as vitamin D and the role it plays in our health and wellness?
you know, uh, my interest was piqued by an article that was in our literature that I came across in 2016, and I'll get to that. But I don't think I would have paid much attention to it if it weren't for what I would say kind of this cultivation of a more functional approach to otolaryngology that I've just kind of naturally walked into. So, I did my medical school and then residency training in otolaryngology, head and neck surgery, 5-year program, and then a 1-year fellowship in subspecialty kind of advanced endoscopic techniques. So certainly not any type of functional medicine pathway, but I spend a lot of my time outside of work. If I'm going to read something, I have just gravitated to reading about wellness, health, and trying to learn some of the uh, nutrition and functional medicine gaps that we've got in our traditional Western medicine educational system. That always just really fascinated me, and I've always thought, I'll have patients that I'll interact with, and just something just really bothers me, and I kind of have this sense that, geez, if we had just gotten to this patient maybe 10 or 12 or 20 years ago and just helped do some type of root cause analysis before the disease pathology got to such an advanced state that, look, all we have now is surgery to try to get you well. There are a lot of conditions that we deal with, even as subspecialists, that if you just do some root cause analysis and look at nutrition, sleep, exercise, what's your daily lifestyle, you will find the answer to a lot of problems just in that right there. And that's why I'm so fascinated by my colleagues who go into functional medicine. And in fact, I work with an anesthesiologist frequently who has gone back and gotten a functional medicine degree and certificate. And that is, kind of, she's in that transition phase. She still practices anesthesiology, and I have the benefit of working with her, and she helps take care of my patients in the OR. Yet she has this other practice that she does now part-time, functional medicine. And so I'm constantly, picking her brain, finding out what I should be reading. And, she can get real technical at times and lose me in the weeds, but and gets over my head pretty quickly. But ultimately, I'm finding that I'm more and more passionate about root cause analysis and, how do you live your life and what went wrong?
That's exciting.
Yeah. So certainly there are times when I'm called upon to just perform a very kind of specific technical task. We've got a tumor in a hard to get location. We need to get that out. But if it's something other than that, if it's chronic inflammatory disease, I really try to think of the patient as a whole. So, as my career evolved, I'm 13 years into practice now. A couple of years ago, I that kind of mindset had been cemented, and then boom, 2016, I'm reading through one of our otolaryngology journals, and there's this article in there about vitamin D deficiency and its association with chronic rhinosinusitis. And I wasn't completely ignorant with respect to vitamin D. I knew what it was from medical school. I knew it was very beneficial for bone health. I knew it prevented rickets, but I wasn't so well educated on its effects on the immune system and the respiratory tract. And so, reading that article, just in the background of the article, realizing how prevalent vitamin D deficiency is in our society. And then it got me thinking about our modern lifestyle. And then I'm thinking, geez, if this is really low hanging fruit, where I have some patients that are really sick with chronic upper respiratory conditions. And in my practice, I have a rhinology practice. I see a lot of complex sinus and nasal issues and some routine ones too, but we see a lot of patients with nasal polyps, recurrent acute sinusitis, chronic sinusitis, and nasal obstruction, sleep issues related to that. And come to find out that vitamin D deficiency is correlated strongly with severity of chronic rhinosinusitis, nasal polyp size, frequency of infection, even the severity of the changes in your sinuses on CT scan are strongly correlated with vitamin D deficiency. So it was really that article in 2016 that that got me thinking. The author was Stokes. It was in the American Journal of Rhinology and Allergy.
Hmm.
If the listeners want to look it up. So that
That's
was it. And
great.
then I was hooked, and then I just started digging. And
So, so
yeah,
that's a great story, and you're talking our language. I mean, here at the Green Medical Practice, everything you say just resonates so strongly, and it's exciting to hear a surgeon talk about that. If you have low vitamin D, then what kind of conditions is that associated with? I would imagine it's vast because if there's a receptor in every single cell,
mhm.
where do the problems lie usually?
Yeah. So we'll start off with the easy one. So the easy one is if your vitamin D is severely low, like in the beginning of the Industrial Revolution, and we had people that used to be outside agricultural society, and now they're living in cities. The kids are playing in dark alleys because of the shadows during the day, and vitamin D was not put into the food. So we had not recognized this as a society yet, and we didn't have vitamin D fortified foods. So those children, that generation, those rickets was an issue. Those people really got severely vitamin D deficient. So, if you look at our lab values, we have, Sonora Quest labs out here, and less than 20 nanograms per ml is vitamin D deficient, technically. I don't know how severely deficient those people were, but probably much less than 20 to get rickets. So, fortunately, as a society, we recognize that the government then promoted and lots of different food manufacturers began fortifying foods with vitamin D. So they started putting vitamin D in the milk, in the orange juice, in the cereals, and now we don't have rickets. It turns out, what I've learned is that it doesn't take a lot of vitamin D
Mm-hmm.
to prevent rickets. It doesn't take a lot
Right,
of vitamin D to optimize your bone health.
right.
But it seems, based on what I've learned recently, that you need more vitamin D to optimize your immune system and your respiratory tract health.
Mm-hmm.
And so it's easy to get the bone metabolism and the bone health right, but then if you are deficient with respect to the immune system and the respiratory tract, then you're going to see things like um, uh, allergic rhinitis with recurrent exacerbations, recurring upper respiratory tract infections,
Mm-hmm.
more prevalent influenza, um, uh, you know, coronary,
Cancer.
cardiovascular disease is
Mm-hmm.
significantly increased. The
Mm-hmm.
association, if you just talk about association and not causation, the association literature for vitamin D
Mm-hmm.
and a myriad of other of pathologies is almost overwhelming. I mean, it's
Yeah.
associated with, like I said, the
Mm-hmm.
autoimmune disease, allergic disease, recurrent infections, cancer. The
Mm-hmm.
list goes on and on and on.
Right. And when
Um,
you say it's low hanging fruit, you're saying, okay, there's an association. We could wait years and years and years for the proof, but what does it harm us to at least take that low hanging fruit
yeah,
and then hopefully enjoy the results of that? Especially with you and I, we see it in our practices and see the results.
yeah,
It's hard to deny it.
yeah. And as clinicians, I'm sure you feel the same as me. We're not. We don't necessarily want to take a huge leap of faith
Mhm.
and just go off of association literature. Association literature, I think, is important. It gets your attention,
Right,
and then it inspires clinical trials,
right.
prospective studies, and that was the next step, and that's already been taken. And there are some good prospective studies out there, and there are
Mhm.
meta-analyses that show that intervention with vitamin D, so vitamin D supplementation,
Mhm.
actually is associated with decreased frequency of upper respiratory tract infection. So, and that was, something I talked about in that lecture. There was a very good meta-analysis with, thousands and thousands of patients that did show there is a
Great.
reduction in frequency of upper respiratory tract infections if you supplement with vitamin D.
Wow.
And that body of literature is getting stronger and stronger. I mean, it's not as voluminous as the association literature, but now those clinical trials are being done and then being coalesced into meta-analyses. So now we've actually got some pretty good evidence that not only is vitamin D associated with recurrent respiratory tract infections and allergic diseases and chronic ailments of the upper respiratory tract, but now vitamin D supplementation seems to improve things.
That's great. And could you tell us a little bit, give us a little bit of a description of how vitamin D actually works in the cell to create an immune protection and what the mechanisms are? Because I'm fascinated with just the elegance of this system and how it involves our T cells and our our antimicrobials. And can you just kind of describe that for me? I think it's fascinating.
Yeah, sure. So the term epigenetics comes up to me, and epigenetics, when you really think about what's going on, that to me just it's kind of fascinating.
It's
Epigenetics is where uh, you know behavior or something you do externally or ingest can then interact with the nucleic acid and modify gene transcription and peptide production in proteins. And that was fascinating to me. So what we see is that when someone is adequately supplemented with vitamin D, that the vitamin D can interact and turn on transcription in our leukocytes and some other cells, and actually create antimicrobial peptides. So that's kind of one way that vitamin D can help. So you're turning on production or up-regulating production of these antimicrobial peptides. So
and what is an antimicrobial peptide?
So there are two that come to mind that I've come across in my reading about vitamin D, and one is Cathelicidin, that's sometimes called antimicrobial peptide 37. You'll see, or LL37. But Cathelicidin is a peptide that's produced, and it goes around and it destroys viruses, fungi, and bacteria. And that is, we've got great evidence that is upregulated with vitamin D supplementation.
Wow.
The other one is beta-2 defensin, similarly antimicrobial peptides. So that's going to upregulate production of that. And so those kind of indiscriminately go out and combat microorganisms that are in us that shouldn't be there.
So it's actually like a natural antibiotic. It's an antibiotic that's made by our biology that we don't have to take by mouth.
Right. Yeah. Fascinating. So you ingest something, or more naturally, and the way our bodies are designed, you get sun exposure that turns on vitamin D production, and that vitamin D circulating in our cells and turns on production of those antimicrobial peptides. So it's like,
wow.
it's all right there. Yeah.
What about the discussion around, people when they're analyzing, the doctors analyzing the real severe cases, they end up on ventilators, and when they analyze what's going on in the body to lead the patient to this devastating situation, they're finding that it's a lot of times the body itself overreacting, the immune system itself overreacting. And a lot of people now have heard the term cytokine storm. And can you give us a few words on what vitamin D does for that situation?
Sure. So first, I want to take the opportunity to just tell you and your listeners, what tremendous respect I have for our intensivists and our critical care nurses,
Yes.
because they're dealing with these patients day in and day out. And I'm a surgical subspecialist, and I walk into the hospital, but I'm not involved in that
Mhm.
critical care, life or death ICU management. But my colleagues are, and even though they've been recognized in the media, I just don't think they get
Right.
their just recognition for how stressful that is day in and day out to go in
Mhm.
there and your
Totally agree.
PPE and care for these patients that are on ventilators. The other day, I cut through one of our. I was making rounds at the hospital and had to go through one of our respiratory care units, and it was just really shocking to look around the whole ICU. And as best I could tell, every patient in that ICU was prone and on a ventilator,
Mm.
and it was chilling to see that.
Mm. Yeah.
Um, so, my colleagues are dealing with these patients that are in the throes of ARDS, secondary to SARS-CoV-2, which
Right.
is COVID-19, and they're dealing with it day in and day out. Now, um, we've heard this term cytokine storm, and that's what happens when someone has SARS-CoV-2 induced ARDS, acute respiratory distress syndrome, and it's my understanding as an otolaryngologist, head and neck surgeon, and what I learned in medical school with ARDS and talking to my colleagues who manage it now, it's not necessarily the virus going in and destroying your tissue in your lungs. What's happening is it's your immune system. Cytokine storm is essentially these circulating molecules, these inflammatory mediators that were produced by your cells, by your immune system, and you're having this overzealous immune response, and that is what ultimately is harming you. It's causing this inflammatory response. Inflammation generally leads to swelling of tissue, production of respiratory secretions, and it's this edema, accumulation of respiratory secretions that then block our delicate airways, and we don't have a way to oxygenate and exchange gas for the patient. And so it's I'm trying to think out of from how to best explain it to someone who's not in medicine. It's not the virus going in and destroying all the tissue. It's actually the immune response. And the fascinating thing about the vitamin D, so the vitamin D is helping you through production of those antimicrobial peptides. It's going out there and attacking viral particles to slow down viral replication. But vitamin D, we've found, and this is probably a more valuable function of vitamin D in the current pandemic, is that it modulates the immune response. So there are pro-inflammatory cytokines, there are anti-inflammatory interleukins and cytokines, and the vitamin D, again, its sophisticated interaction with our machinery helps just regulate that, so that the pro-inflammatory cytokines that get out of control in the ARDS are downregulated.
Wow.
So what we're finding in the COVID-19 association literature now is that vitamin D deficiency is associated with a worse outcome if you have COVID-19. And we think it's because vitamin D, when you're supplemented or when you're sufficient, you are downregulating the pro-inflammatory cytokines in your system. When you don't have sufficient vitamin D to downregulate the pro-inflammatory cytokines that participate in the cytokine storm, you have this unmitigated proliferation of these cytokines, this unmitigated response of inflammation in your respiratory tract and the lower respiratory tract where it's most crucial, and you just ultimately then can't exchange gases.
Wow. It's an amazing molecule. And when I think of the comorbid state, they talk about comorbidities, and everybody's aware of all of them now. I really want to include vitamin D deficiency as a comorbidity, and I think it 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 almost rises to that level. And what's curious is a lot of the comorbidities you can see people that have had trouble with their health, and or if they're in their late elderly states and weakened. But you could look so healthy and still have a very low vitamin D, and I see that too in
Mhm.
my office. And that person, I I feel like could be at risk if they get that young person. And we do hear, I mean, that's kind of the scariest of all reports is when you hear of a 30-year-old or a 40-year-old uh, getting to that same state where they have to be on a respirator. And I, there's no way to turn back the clock and figure it out, but it really does give me that question of whether there was a comorbid state that just was unnoticed in that patient.
I agree with you, Paul. Just this morning, I was hiking with a friend, and that person had a friend that unfortunately passed away from COVID-19. And I was just thinking in my head, gosh, because that person wouldn't necessarily strike you as high risk as it was described to me. Uh,
Mhm.
but boy, I just wonder I'm curious, a lot of these cases where we don't have an explanation, gosh, the person was so healthy, got COVID-19, didn't do so well. You just wonder what was the vitamin D level. And, I might uh, not have, maybe I look at everything through a vitamin D lens now, probably guilty of that, but I just wonder. Now, curiously, you mentioned some of the other comorbidities, advanced age, obesity we know about, and then there's also the melanin content in the skin. Interestingly, those are folks who, prior to the pandemic, we knew that those are the folks that are also at risk for vitamin D deficiency.
Yeah, right.
We know that if you're elderly, your skin is not as proficient at producing vitamin D through its interaction with the sun.
Wow.
So you're at risk. Um, Obesity, vitamin D is a fat soluble vitamin. So the amount of available vitamin D is not so, uh, you don't have as much available in obesity. So folks who are obese are at higher risk of vitamin D. And then the melanin content in your skin. So the darker the skin, the less UVB radiation penetrates the skin and less of it is available to activate that 7-dehydrocholesterol. So
Wow.
curiously, those those risk factors for doing poorly with COVID-19 are the same risk factors that are associated with vitamin D
Yeah,
deficiency.
this is such great information, Ryan, because what it leads us to, it's not hard to understand once you laid it out that way, and people can grasp it. I always say, what's the reason behind the recommendation, or how we can sit and tell people to do this and that, but if they don't have the reason behind it, then they don't quite get it and they don't quite do it, but they don't have the self motivation. But this information is so empowering, and it gives tools to our patients, that they now can, take charge and have this kind of lifted spirit in a way, and an empowered feeling. And if there's anything that we need is a dose of, cheering us on and having us having kind of a positive attitude, because as you know, positive attitudes actually turn on immune response too.
And I also wanted to just add one, and I really want to echo your thoughts on empowerment. And some of my non-physician friends asked me early on in the pandemic, what do you recommend, Ryan? And
Mhm.
certainly I'm no expert on infectious disease, but um, I was thinking, well, if you are diagnosed with COVID-19 and then you decide to supplement with vitamin D, it might be too late. So,
Mhm.
you can supplement with vitamin D. Um, you know, the endocrinology societies typically recommend 2,000 IU's daily. I'm certainly not, you know, um, offering medical consultation to anybody, but that's generally what I tell my patients. 2,000 IU's daily; those are standard recommendations. But um, also get your respiratory tract in shape. So if I'm gonna get exposed to coronavirus, COVID-19, I want to make sure my respiratory tract is optimized. So, we should all be, exercising, getting some good cardiovascular exercising in, eating right, the vitamin D piece, of course.
Yeah.
And the other thing I want to add is, you know, this vitamin D deficiency. So it is vitamin D deficiency is widespread, um, and it has a lot to do with our modern lifestyle.
Hmm.
Humans are optimized to live in ex, an outside environment, um, akin to like a hunter-gatherer lifestyle. If you look at some of the few hunter-gatherer lifestyles we've had, they've studied at least one of them and found that the hunter-gatherer cultures that still have primarily an outside existence, they run their vitamin D, 40 to 60 in that range. So
Hmm.
that's probably optimal.
Yeah.
And for immune health, let alone bone health. Um, and so my point is, we got into this vitamin D deficiency mess because of our modern lifestyle. So most of us, adults and children included, we are not outside most of the day.
Right.
We are inside and we are working on computers, we are on devices,
Right.
and we have actually very little reason to go outside and get sun exposure between the hours of 10 and 3, when the zenith of the sun is appropriate to make vitamin D. So we were an easy target for a pandemic, really.
Hmm.
But here's the thing: the pandemic has made it worse, because now, with all of this isolation and shutting down kids, outdoor sporting activities and all of that,
Right.
now we have driven our society even more towards devices
Right.
and more towards computers and indoor and isolation.
Mhm.
And that's my concern, because
Mhm.
really we've gotten away from the healthy lifestyles that our bodies are optimized for. And so I just really want to bring attention to that, because even in my household, I have 4 children, and you and I are on a device and inside, and it's tough to get our kids to get outside and engage in these activities, because the pandemic just caused us to shut down and
Yeah.
now connect with people through devices. And I am not an anti-technology person at all. Certainly in my surgical practice, I love technology. I embrace it, but we can't lose sight of the fact of, you know, um, we have the machinery. This machinery is optimized to
Mhm.
work in not necessarily indoor uh, computerized environments. It wouldn't
Right.
hurt to get outside and exercise more and get a little sun.
So well, so well said, Ryan. Very, very good. And another thing to do is to get your vitamin D level, right? Because I know I found that people do have different needs. I'm not sure exactly why some people have a harder time than others getting their vitamin D level up, but I think the level and the actual blood test is a really good idea.
Absolutely, I couldn't agree with you more. You really, check the level. And I agree with you. Sometimes, it's like a head scratcher to me, because I'll see, patients who come in and they're not taking any vitamin D, and I
Mhm.
think they're going to be low and they're not. And then I have patients that are taking 5,000 international units a day, and we check them and they're low. And
Mhm.
I think that speaks to, well, the absorption. So it is a fat soluble vitamin. I've read that you're supposed to take it with, some type of fatty meal that helps absorption. Um, and so my point is, like you said, you just don't know unless you check the level. And we certainly don't want to, I mean, you can get into trouble with vitamin D supplementation too. There are certainly some reports out there of vitamin D toxicity, although my opinion is that it's very hard to get vitamin D toxic.
Yeah.
Um, but yeah, you want to check your level, see where you're at, and then you'll know if what you're doing to supplement is adequate, or what you're doing for your sensible sun exposure is adequate.
Very good.
Anyone can reach me through our website, Valley ENT. So it's AZVENT .com. ArizonaSinus.com. So whole word, ArizonaSinus.com. For clinicians, I'm also on Doximity. You can find me on Doximity, Ryan Rehl, it's REHL. So happy to interact, collaborate, answer questions.
Very good, Ryan. Thanks again. And hopefully we'll meet up again soon. And if there's anything else new that comes across your desk, we're certainly interested. So keep in touch, and you have a good day today.
You too. Thank you so much, Paul. I really enjoyed
Thanks,
it.
Ryan. You take care. Have a great day.
Bye.
Bye.